Hello and welcome to my channel. I am Henry, a professional psychologist. I hope you will be fine. Today we will talk about how important sex is in a relationship, why it can be important to have sex, some of the benefits it may have, and statistics on how often couples typically have sex. It even covers challenges you might face as a sexual couple and what you can do if you want to increase the amount of sex in your relationship. We daily upload psychological episodes on this channel. If you are interested, you can subscribe to our channel. We request you to please use headphones for a better experience. Thank you. In a supportive relationship, there are many benefits to having more sex. Higher rates of sexual activity are linked to positive changes, such as lower blood pressure, reduced stress, greater intimacy, and even a lower divorce rate. While there are no one-size-fits-all rules when it comes to an ideal sex frequency, we share insight from the latest research. Let's talk about today's topic. Why sex is important in relationships. Can a relationship survive without sex? Yes. Sex isn't always necessary, but it can be an important part of a healthy, fulfilling relationship. How important sex is can vary from one individual to the next. Some people may feel that being a sexual couple is absolutely vital. Others may feel that other types of intimacy and connection are more important. Some of the reasons that you might feel that sex is important in a relationship include feeling closer to your partner, showing affection to your partner, finding sex fun and pleasurable, a desire to have children, feeling confident and sexy, relieving stress. Research suggests that having frequent sex can play a role in a person's overall well-being. Having sex often is linked to more affection. When couples experience more affection, they are also more likely to then have more frequent sex. Let's talk about the benefits of sex in relationships. Beyond individual benefits for you and your partner, regular sex supports a healthy relationship in a number of ways. For instance, the oxytocin released during sex enhances a sense of bonding and improves emotional intimacy. Sex in a monogamous relationship increases your level of commitment and emotional connection with the other person. Expressing love through sex increases the likelihood of couples staying together. As a result, sex is positively associated with a lower divorce rate. And now these are the psychological benefits of sex. There are many emotional and psychological benefits of making love. Sex is strongly linked to a better quality of life. Some of these benefits include better self-image. Sex can boost self-esteem and reduce feelings of insecurity, leading to more positive perceptions of ourselves. Higher rates of happiness. According to a 2015 study conducted in China, more consensual sex and better quality sex increase happiness. More bonding. Brain chemicals are released during sex, including endorphins, which decrease irritability and feelings of depression. Another hormone, oxytocin, the hug drug, increases with nipple stimulation and other sexual activity. Oxytocin helps foster a sense of calmness and contentment. Stress relief. Chronic stress may contribute to lower sex frequency. However, sex can be an effective stress management technique. Sex reduces stress response hormones, like cortisol and adrenaline, epinephrine, with effects lasting well into the next day. Improved sleep quality. Orgasms trigger the release of the hormone prolactin, which aids sleep. And now these are the physical benefits of increased sex. It's fairly intuitive to understand how sex improves emotional health, but there are a number of physical benefits from sex as well. Some of these include better physical fitness. Sex is a form of exercise. According to the American Heart Association, sexual activity is equivalent to moderate physical activities, like brisk walking or climbing 2 flights of stairs. The motion of sex can tighten and tone abdominal and pelvic muscles. For women, improved muscle tone improves bladder control. Enhanced brain function. Preliminary studies on rats found that more frequent intercourse was correlated with better cognitive function and the growth of new brain cells. Similar benefits have since been observed in human studies. A 2018 study of over 6,000 adults linked frequent sex with better memory performance in adults ages 50 and older. Improved immune function. Being more sexually active has positive effects on immune function. Regular sex may even lower your likelihood of getting a cold or the flu. Lower pain levels. The endorphins from sex promote more than just a sense of well-being and calm. Sex endorphins also appear to reduce migraine and back pain. Weight loss. Having sex for 30 minutes burns an average of 200 calories. The rewarding brain chemicals released during sex can subdue food cravings and support weight loss. Positive cardiac effects. Penile vaginal sexual activity, but not masturbation, has been linked with lower systolic blood pressure. Elevated blood pressure increases the risk of heart disease and stroke. Sexual activity helps dilate blood vessels, increasing the delivery of oxygen and nutrients throughout the body while reducing blood pressure. Additional physical benefits. Being more sexually active boosts libido and increases vaginal lubrication. Frequent intercourse is associated with lighter menstrual periods and less painful period cramps. In addition, an improved sense of smell, healthier teeth, better digestion, and glowing skin may be related to the release of the hormone DHEA by the body after orgasm. Ideal frequency for sex. When considering how often a couple should have sex, a 2015 study found that general well-being is associated with sexual frequency, but only to an extent. Relationship satisfaction improved progressively from having no sex up to having sex once a week, but did not improve further, and actually decreased somewhat beyond this point. One sexual encounter per week is fairly consistent with the current average. However, our increasingly busy lives may be getting in the way of having more sex. Compared to the frequency of sex in the 1990s, adults in 2010 were having sex 9 fewer times per year. This is an average sexual frequency. Average adult, 54 times per year, about once per week. Adults in their 20s, around 80 times per year. Adults in their 60s, 20 times per year. And at last, these are the challenges of regular sex. While sex can be important in a relationship, there are a variety of factors that can make being a sexual couple more challenging. Age, hormones, children, stress, medical conditions, and relationship difficulties can all play a role in how frequently couples engage in sex. Age often plays a role in sex frequency, largely due to declines in sex hormone levels as people get older. Sometimes, maintaining an active sex life is difficult or impossible due to physical or psychological conditions. Humans are wired to crave the intimacy of sex. Lacking sex can lead individuals in a relationship to grow distant and, perhaps, look elsewhere. Working with a licensed couples therapist can help address this gap and prevent issues from permeating throughout your marriage. Ways to build intimacy outside of sex. Couples can maintain a strong, healthy relationship despite these barriers by looking at non-sexual ways to improve intimacy. Ideas to consider include cuddling while watching a movie or sitting in the park. Doing activities together that you both enjoy, such as dancing. Giving frequent hugs and kisses. Holding hands when you're walking together. Spending time talking to each other. We hope you enjoyed this episode. Please like this and share it with your friends. Please subscribe to our channel. Thanks for watching. Goodbye.